Doc, thank you so much for being here with us today.
Thanks, it's amazing.
It's amazing.
Yes.
Dr. Goran from NDU Clinic in London. As you know, he was yesterday doing all the amalgams for me, so he removed all the amalgams from my mouth. And today we're going to be talking about everything about amalgams, right?
Yep.
And about metals, and I'm going to be asking him all the questions that you send him. But first of all, and most importantly, we want to know about scans.
Scans.
Because you told me before that when a patient comes and they don't want to scan, it can become a problem. So let's talk about scans first, why they're so important, and then we can talk about amalgams and metals.
Okay.
So why are scans so important?
Just to understand, you are thinking of scans for a patient who is concerned about his root canals, or just wants to understand what is his dental history?
Well, go on, educate me and educate us all.
I guess the people that are asking are the ones that are slightly concerned about root canals. Root canals is when the nerve out of the tooth is taken out because the tooth either had a trauma or has died, so the vitality of the tooth is gone. Then we have different scans. We take a regular dental x-ray, which is a 2D. We can take a small one, so it just shows a tiny area. We can take a slightly bigger one, which shows a full mouth, but it's still a two-dimensional scan. It's called the OPG. Or we can take a scan which is 3D. The 3D is really important because when you have the 2D, you have an image of all the layers, and sometimes the inflammation can be hidden. So it's somewhere behind the root that you can't see it. When you take a 3D scan, you actually cut into the layers, and then you can really understand where's the infection sitting. We have a lot of times patients coming in that are saying the root canal is fine. Even we had a patient with only us, we did only a 2D image, and then we realized that after taking the 3D scan, it was surprising how much infection we actually saw. So in order to understand, are my teeth healthy, is there inflammation anywhere, the 3D scan I think is the gold standard. It's the best way to really check.
To understand basically what's going on in your mouth, if you've got inflammation, if you've got infection, if you've got root canals, cavitations as well?
Cavitations as well. So we look at areas where the wisdom teeth were taken out, or we look at an area where any tooth was taken out. And in those particular areas, you can have sometimes an area where the bone has not healed. The bone is not very dense. There's a doctor in Munich, Dr. Lechner. He's done a lot of studies on cavitations, and he has a lot of publications on cavitations. So he really did the footwork. And for us, it's just to have the knowledge that there is a potential area where there could be cavitation, and then to look for it. And then the scan is the best way. A regular small dental x-ray will not show you enough. A regular 2D x-ray will not show you enough. So the scan really gives additional information.
And it will give you the full picture, basically.
And it gives you the full picture. Yes.
So then when you are actually doing the treatment, you know what you're going to find and you know what you have to treat.
We know where we have to treat. We know which area it's positioned, it's located. On root canals, it's really important. It would be nice if we could, maybe you can put this in later, I don't know if it can be done, or just show an image of that, of a patient where you can see a 2D scan and where you can see the 3D. And then you can see the difference of the inflammation,
Maybe we
which is
can do
actually
that
showing.
with my own, actually.
Yes.
Yeah, because I've got an X-ray, a full X-ray of my mouth, and I also have the 3D that Dr. Domi did in Germany. Yeah. So maybe we can show you here somewhere in the video the difference between them and what difference we can see between the X-ray and the 3D.
Yes.
And that way we can illustrate the point better.
Yeah.
Perfect. Yeah. So that's why they're so important. Basically, if you don't have one of these scans, you don't know what you're going to find. You don't know what you have to treat. You probably don't know about cavitations and things that you could have. So that's super important.
The dentist should check, is there actually a reason to take a scan? Maybe there is no reason to take the scan. And sometimes I have patients that are hearing a lot of information and that are starting to worry and saying, I have a problem with my amalgams. Yeah. And suddenly we realize there are no amalgams in the mouth. Oh, wow. So there are no amalgam filled teeth present. There's not even a tooth taken out. Because you hear so much, you think suddenly, okay, this is maybe the problem. So the dentist first has a look. If it's a biological dentist, he has a look, and then he will understand if it's necessary to take a scan or not.
I understand, because the most important thing, like we were saying yesterday, and this is very important with your philosophy, I think, Goran, is never worry someone if you don't have a solution for that person, right? Because otherwise you're creating more stress, and that is completely wreaks havoc with the body, right?
Yes.
Stress is even worse. So always give a solution. And the good thing about Dr. Goran is that he doesn't like to stress you out if he's not going to give you a solution for it. So always check if you actually need the scan, but if you do, it's going to help you understand what's going on, right? Yeah? Anything else about scans?
No.
Shall we move?
I'm sure we're going to get back to scans later.
Yeah, and we'll get a lot of questions,
Yes,
and we can do
yes,
another Q&A
yes,
in a few weeks where
yes,
people can ask more questions,
yes.
because people are going to have a lot of questions
Yes,
about this.
yeah.
Perfect. So I just need you to please open that so we can go through all your questions. And this is very important. They're asking me a lot of what is the substitute for an amalgam? What is the best substitute for an amalgam?
The best one are white fillings, composite fillings. The best, best substitute for the amalgam is a ceramic. If we think of what has the least negative effect, it's going to be a ceramic. Then there's the counter argument that a ceramic will have the glue, obviously, but there's a thin layer of glue. If it's a ceramic, the whole block is made out of one. You place it where the filling was taken out and you cement it in. The next best option is a filling. If the cavity is relatively small, then I feel there's no need for a ceramic.
Yeah.
If it's relatively small. Sometimes it's too small and then you have to make the cavity bigger to actually make a ceramic. Then we destroy more tooth for the sake of ceramic.
Yeah, I understand.
But there are patients that maybe have a sensitivity towards the composite, the white fillings. Well, then there has to be another solution. And there can also be temporary fillings, which is glasionomer cement. So depending how big the filling is, you temporize it first, you maybe place a glasionomer cement, but we are moving away from that slowly. So we are going into composites straight away, or the ceramics.
Ceramics is what you did on my 6 and 7,
Yes.
because
Yes.
they were like big
Yes.
amalgams.
Yeah, so it was slightly bigger, and then we shaped it in a way, and then you take an impression, or you take a digital scan, and then once you have the digital scan, then you start milling the ceramic, and then you get the nice shaped tooth again.
In
You
3D,
cement it
guys,
again.
you're gonna see in the video.
Yes.
Probably the video of the whole treatment is gonna be before this interview. It's gonna be published
Okay.
before this interview. So if you wanna see how they did it, you can watch it in that video. I'm gonna leave it in the box below and everything, so you can watch it, or here on the corners. It was really cool how you printed it in 3D, and it fit perfectly in my tooth, and now it looks like my tooth. It looks amazing. It's super cool.
Yeah, it's very cool.
Very cool. Perfect. Many people are asking me this, and I'm very curious about this from your perspective. This is something that they did to me as well as a kid, and it was giving me fluoride as a kid, like fluoride tabs, because dentists, I don't know if that's so common in Europe, but for us, for me growing up, in the 80s and 90s, it was very common to give us fluoride tablets, because apparently that makes your teeth stronger as a kid.
Yes.
But we know that fluoride is quite toxic.
It's quite toxic, yes.
So many people asked about this. What is your point of view here?
There's also the idea to add fluoride into water.
Yeah.
And still in some areas they put fluoride in the water because they fear if the area is not... If the society in this area is struggling with decay, if you add fluoride into the water, you make the teeth stronger. It's a very touchy subject. I think fluoride is a toxic substance. It's always talked about, well, it's about the percentage.
Yeah.
It's very low percentage, it's not so toxic. But the tablet fluoridation or the water fluoridation is not the greatest because it's systemic. Another one would be where it's fluoride out of paste.
Yeah.
That's topical fluoridation. I think just to compare it, the topical is not as bad as the
Especially
systemic.
if you don't swallow it.
If you don't swallow it. So if you just have it in the toothpaste, it's fine. If you have travel toothpaste, some people have this, maybe you get it from like the basic companies, you have that. Our teeth actually don't get stronger. Well, this might help, but they don't get stronger from the outside, but they get stronger from the inside.
Claro.
So if we have a good diet, if we have good health, we will have strong bones, strong muscles, strong ligaments, etc., etc.
And teeth are bones.
And
so.
teeth then obviously as well. Once we have ruined the health of our teeth, we can't create them back again. Then we have to fix those issues.
Yeah.
And I want to be slightly careful with the fluoride, because some people then just say no more fluoride, nothing, but it also leads to other extremes. But I think it's not necessary. I don't think it's really necessary to have fluoride in the paste to have strong teeth. But potentially, if we don't have the best diet, maybe for a specific time, it might be not such a bad solution.
In the paste.
In the paste.
But
Definitely,
I would say
I think
for
only
kids,
in the paste.
would you agree that
Tablets,
for kids, the best,
I wouldn't.
I
Yes.
wouldn't. And the best thing would be to give kids an appropriate diet. And not to give in like candy, because
Lifestyle,
right?
Lifestyle is key to health. Lifestyle is key to very strong, healthy body.
Exactly.
And kids, there are some cultures that are giving diluted apple juice for kids to drink while they sleep. I know of some areas, but it's not important where. But then if you have diluted apple juice, it's sugar intake constantly.
Of course.
And we had a few kids in the clinics at university where you had to put the kid under general anesthetic and take all the teeth out at 3 years. So all of the teeth were black and rotten because they had a constant sugar intake, and it only takes 2 years, 1.5 years. That's it. All the baby teeth completely destroyed. So the diet is number one. The other one is these sweets that are stuck to teeth. You know, they have a jelly, and the jelly is just sitting somewhere, and the sugar intake is really destroying kids' teeth. I mean, best diet is that's it. That's number one. Kids should have
an appropriate diet.
Water. Water is your liquid that you need.
And coffee, cafecito, no?
Cafecito.
But that's for us.
Cafecito sometimes.
The only liquid that humans should drink is water.
Yes.
Right? Many people asking as well about the metals in orthodontics.
Okay.
What are the problems with metals in orthodontics?
So interesting in orthodontics, and I'm not sure when this is coming up or not, but we had a short interview with Linda from Malaysia. The Malaysia test is a test which is checking your heavy metal allergy, your heavy metal sensitivity. So you do blood test and you can find if you have an allergic reaction towards metal systemically. Now the problem with orthodontics is that 30% roughly of women have nickel allergies.
Oh wow.
I think they even say the numbers are higher.
In women particularly?
In women particularly. Women a lot more than men. The wires and the metals in orthodontics, the wires can contain nickel. So if you have an allergy to this and you have the wires, you chronically, constantly have for 1.5 years, for 2 years' time, this influence. I'd say if you would notice your health really deteriorates, the health of the child, whilst having orthodontics, maybe you should really look into the metals. And depending what the health is doing, maybe it's a time to say no orthodontics.
Yeah.
Because you have to balance out. You have to balance out what's more important. On the other hand, if it's not that bad, and you know there could be a small issue, the orthodontics is important, the bite is very important. So you fix it, you have it for 1.5 years, and then you get rid of the metals. The other chelation then later, yes. But the other one is that once the orthodontics is done, usually it's placing a small wire at the bottom or at the top teeth to keep the position.
Retenedor, that's what we call in Spanish retenedor, which is like a retainer.
Like a matador for the teeth.
Yeah, exactly.
Yes.
It's a retainer.
It's
retenedor. That's what we call it.
So this is usually a wire, and this wire can also contain nickel. Now, for kids orthodontics, I would urge parents to actually get the teeth of the kids checked and start checking them properly when they're 5-6 years old, to see if the positioning of the jaw is correct, if the bite is actually in a good position. There are some ideas to let everything just leave until they're 13, but there's another idea of, well, then you just take 4 teeth out, you do wires, straight appliances, and everything's perfectly straight. But
that
then
was me.
It's not looking into the functionality of the jaw. So you want to start when they're young, 5, 6, 7 years old, and then you want to widen the arch, and then you want to create the space, and then when you have the space later on, you will have the right bite, the right occlusion. And then you don't have to go into so much orthodontic treatment. Maybe you can do clear aligners now, you can do Invisalign.
Exactly.
You have other options for that.
That's super important as well. So we need to start looking at our kids' bites since they're very young, like 5-6 years old.
Look for somebody who does functional orthodontics.
Functional orthodontics. Do you know anyone in Europe, anyone in London, anyone in...
Well, there are societies for functional orthodontics.
Okay, we can put them maybe on the links.
And there are some dentists that are doing functional orthodontics.
Super important.
Yeah, so we can maybe find some links for that.
Perfect, we'll do that. Perfect. So in case you already have had exposure to metals through orthodontics or through like root canals and things like that, how do you reverse the damage? Or is there a way to reverse the damage or the metals that are in your body? First of all, you need to find out you've got the metals in your body, right?
Yes.
Usually you do that with a hair test.
Hair test or urine test, blood test. So then ideally is you work with nutritionist or environmental doctor. I think the best is always to work with nutritionists, environmental doctors. They have an understanding of heavy metal issues. They do the specific tests that are needed. They check your levels, and then they give you specific supplements, specific foods, dietary advice to try to get the detoxification going. Our body is made to detoxify. I mean, our food is made to help us detoxify. It's normal.
We just don't want to overwhelm the body too much, right?
Yes. If there is something within our system which might be on a slightly higher level, well then maybe we have to add something into this to actually get rid of that.
Okay.
So then nutritionists are perfect for this, and they have an understanding of that.
Perfect. So like functional nutritionists?
Yes, yeah.
Many people asking about gold, and we talked about this yesterday.
What do they want to know about gold?
Is gold safe? Because many people have gold, especially from like the 70s and 80s.
I think gold is really good from the 70s, 80s. Is very good at the moment. The price is going up.
Gold is good around your neck and your fingers.
You take it out and leave it in the small box, and you go up in value.
And then Goran comes and picks it up.
And we pick it up and we have a Christmas party.
Exactly. So gold is very good.
Gold is very good.
Yeah.
The other one is it's never pure gold. There is one type of filling which is pretty much pure gold. Mm-hmm. It's a very cool filling, but we'll not talk about this, it's too much. But any metal we have in dentistry is never a pure metal. So it's always an amalgamation, it's always an alloy. There are always different metals inside.
Also because gold alone is very malleable, right? It's very soft.
Gold is very soft. That's why these really cool fillings, mostly kids from dentists have those fillings.
Oh wow.
Because then the dentist is spending the time for the kids. You won't do it for patients,
no.
But just for kids. It's very soft, and you hit it into the tooth, you mold it.
Yeah.
And it's also a very long-lasting filling, and that's very pure in content.
Okay.
But why the gold is not good? Because none of the ones that we have gold crowns or gold inlays are that pure. So there can be other metals inside. You know, we have the question, is it taking it too far to even remove gold inlays? Or is it taking it too far to even remove gold crowns? I feel, and that was in the discussion with Linda as well yesterday, I feel that it's an overexposure of metals, overexposure of heavy metals. So the less heavy metals we use in dentistry, the better it is. This is the area of medicine where we can actually get rid of metals. If we need to have any implants, spinal implants, if we break the foot or anything, then we have to use the metals.
Yeah.
So we leave our body to be exposed to the metals when it's really needed. In dentistry, we can now get away from metals and do everything ceramic, non-metallic.
There is going to be another interview that we did with Linda yesterday from Eliza. I'm going to be leaving here as well, and in the box below where you can learn more about exposure to metals, how to determine if you're sensitive to those metals. If you're not sensitive, doesn't mean that they're not bad for you. But it's going to be more explanation on that, and it's going to be here and in the box below as well. If someone has already had their amalgams taken out, this is another very common question, and they didn't do any protocol, so basically they were exposed to the metals and to the amalgams. Can we do something to help ourselves, even though it's been done already? Within what time frame? Or
number one, something to look at is, if it's done by a dentist or by us, anybody can have a bad day. Sometimes you leave a bit of amalgam behind. It can happen. But if it's done by a dentist who says, okay, you want to remove it, I will do it for you. He's not always so worried about really removing the whole lot. So he might leave a little bit behind. So it's good to first of all check with an x-ray to see is all of the metal out. Once the x-ray has shown everything is out, the next step would be check with a nutritionist, do the different tests and see if you have levels. If all the metals are taken out, the ELISA test, depending what your health is. If your health is really struggling, if it's a chronic disease which is a little bit more serious, maybe you might also want to do the ELISA test. Because if the ELISA test shows a higher result, it could mean that there is still some exposure somewhere.
I understand.
We didn't mention this yesterday, but there's a really interesting case where the patient had an allergy to metal. And they removed the metal from the mouth and the symptoms got a lot better. Now, I don't know which symptoms. We can ask Linda and maybe it can be placed somewhere, I don't know. So the metal was out, the symptoms got better, the patient felt a lot better. Then a little bit later, the patient goes back to the dentist and has a white filling done and just has the work done with the burrs, with the drills. And there's one drill which we use to take decay out. It's a carbamide burr. And only by removing the decay, that was enough to create exposure to the metal, and the symptoms for this patient came back again.
Incredible.
So it's quite incredible how little can actually spike it. And why I'm saying this, if the ELISA is showing positive result, could mean that there's still somewhere some exposure. So the x-ray could be something. Maybe there's exposure with maybe tattoo, maybe it's a body piercing, maybe it's actually a plate within a bone somewhere which the patient forgot about.
Could be cosmetics as well.
Could be cosmetics, we talk about cosmetics. Lots of cosmetics have titanium dioxide. And there can be a lot of areas where there can still be some metal. And then ELISA is this side, and then the other side is the test with nutritionists. If we see higher levels, detox, you know, do the whole process, There are different ways to detoxify. Everybody has a different system. I don't think we should say what is the best. Important is you find one that you can trust, you find one through recommendation, and you go with it.
Yes. And trust it as well. And trust.
And maybe it's not once, maybe once is not enough. You don't know, maybe you need to go through it 2-3 times. We had a conference and one of the doctors was talking about his detox mechanism, and he said he had to do it 7 times. 7 times, a whole process.
To reduce the levels.
To reduce the levels. And only in the end, something happened and suddenly, the levels just got down.
Wow.
And also the patient really then felt a lot better.
Wow. For those that follow me as well, you know that usually what I do, and I've done it for this video, you saw at the beginning of the day when I was having the treatment with Goran, is that I do a hair test, and in that hair test by Omnos in this case, which I'm going to leave in the box below as well, is how I found out about my own exposure to these metals. Doc, that's amazing, everything that you've been telling us. I hope that you guys are getting a lot of information from this, and don't worry, because we are going to be having a Q&A later with all the questions. We're going to be bothering you a lot.
Okay, more questions, good.
See?
Good.
Do you like questions?
Yeah, I love questions.
Okay. Doc, the last 2 questions, and then anything that you want to tell us and anything you want to add.
Yeah.
But very important, what do you think the relationship between amalgams and neurodegenerative illnesses? Good question.
Good question. The relationship. The IOMT, which is the International Academy for Medicine and Toxicology, has done a lot of studies on amalgam, on mercury. And they have done studies to check the effect of amalgam to nerves. And they found that is a neurotoxin. We know it's a neurotoxin, but they also found nerve degeneration when the nerve is exposed to mercury. There's a really cool video on YouTube where you can see this actually, and I think it was mice brain cells.
Oh wow.
So it's a neurotoxin. If there is a disease, for example a multineuron disease, and if the mercury is directly contributing to this, we don't know. But what we do is we try to remove anything that can cause chronic stress. So in that case of such a patient, it's the decision of the patient, and then you remove that exposure. So why not? Why not just get rid of the toxins?
We do know
if we know it's a toxin.
Yeah, we do know it's a toxin. We do know it's toxic to neurons.
Yes.
So why not remove it, right?
And for some people, a little bit of exposure can be a lot. For others, not.
Resilience, right? It depends on the person.
Exactly.
The overload, the capacity of your body to deal with it. Yeah. We're all different, right?
And other stressors that are then coming into the whole equation. And then if you remove the stressors, which one is the main one to have a huge effect? We don't know. But that's also our life and our health. We start removing or start improving our lifestyle because we know we're going to have better quality of life. But which one is the biggest effect? We don't know. We just talked about cycling. And I remember when I started cycling again last year, and then I was getting ready for some nice cycling trip, and I really noticed how much happier and how much fresher I was and how much better I felt. And then at the same time as I did the cycling, then I listened to a podcast about the psychological effect and cycling, how good cycling is for mental health. And I thought, wow, that's amazing. So I felt it first, and then I was listening to this. I mean, sports is always good for mental health. But especially the cycling has something very specific. You have to listen to that podcast. We'll put it in there.
Put it in the box.
Put it in the box. Everything in the box.
Everything is in the box. And it tells you about the positive effects of it.
The positive effect. So we do things slowly, bit by bit. So we improve things. And one thing will be a huge change in your life, and another thing which would be for this other person a bigger change, wasn't maybe so much for yourself. We remove toxins, we remove stressors, chronic stress, and then obviously our life will get better. Life will get better.
You actually just asked me, we were having coffee before this interview, and then we were questioning, right, when do you stop? Like, especially with us biohackers, one of the things that we do as biohackers is we always try to improve our bodies and improve our health, and it's like it's never a limit, right? It's never a stop. When do you stop improving and biohacking? For me, being like, it's different kinds of biohackers. I also had this conversation with Tim yesterday and with Safina. So there's different biohackers. Some biohackers are willing to even put more stuff in their bodies to kind of like become younger or live longer or things like that. I think us, at least this group that I share with you guys and everything, we are what I call natural biohackers. So we're not willing to put things in our body. We are more willing to take things out of our bodies. to become closer to nature and closer to the way that we were born. And my answer to you is, when do I stop? I stop when everything that I wasn't born with is out of my body. Obviously, there are things that I still need, because I need the implants, because I lost their teeth. But at least replace them with things that are not going to be affecting me as much, at least.
Exactly.
Right? It's like, if you can do it, why not? Try to always
That's
improve.
the moment you reach nirvana.
Right?
No, but that's the moment you reached a very good level of your own ability.
Exactly. And then you just keep living your life. Like I say, in the 5 pillars of health, and because you don't have anything else in your body that is interrupting that, then you can really be optimized, and your body can really be resilient. Because if you remove yourself from your body, if you remove all the bad things and your bad thoughts and your stress, and you live according to nature and according to your DNA, then your body is very resilient. Very resilient, and can take a lot. Your body can take a lot. Excellent. So the last question will be, and this is, I think, a closed one, is like, if you cannot remove those metals, is there a way to improve your health or to be better?
Well, it just depends who's asking. Who's asking?
Who's asking? Who are you?
Asking? Who are you? So when you sit in the chair, and really it's so different. So let's take a patient example. The one who said, oh, I have to remove my fillings, and I'm sick, and this is not good, etc., etc. And then she opens her mouth, and I look inside, and there's no filling. I said, well, you're really good, you're optimized, there's no filling. Or you have somebody who's really worried and says, I don't want to remove because it's too invasive, I heard that it's not good, and suddenly it's the tiniest filling, somewhere on the side, no negative effect by taking this out, so why not do it? And then you have the other one that says, oh, I just have a few fillings, but then it's huge, full load. We always have to understand what is the consequence of actually doing this. That has to be explained by the dentist, that has to be understood by the patient. What are the consequences of doing that treatment? And does the patient want to go through this? We would always recommend, yes, it's nice to take the fillings out, because we think there are better options at the moment. And can you optimize? Well, if you think of it that you have potentially a higher level of mercury in your system or other metals, and you still have fillings, or you're still eating heavily loaded fish with mercury, methylmercury, what do you expect? You will expect to reduce the levels, but then you add more on top because of the fish exposure. And then you reduce the levels again, and then you add on top.
Or you're using cosmetics. Or
use cosmetics. Or when you think about nickel, can you keep the wire if it is nickel and you have a nickel problem?
Or your body piercing.
Yes. A lot of women, which Linda tells me, I don't have that contact so much, but also some of my patients tell me, cheap jewelry is not good for them. So they know when they buy cheaper stuff, they get a rash, they get an irritation, they notice maybe some piercing, has always a constant irritation. If that's the case, nickel is not good. So then the wire that you have on the inside shouldn't be there. You can't really do anything to make it better unless you take it out. Then you have another reason why you would like to address it, is the potential galvanic element. Metals act like battery, especially the similar metals in the mouth act like a battery, and this can be for some patients a problem. Now this is again an effect which we know is not the best for us, which is done a lot by Dr. Scott Schroeder, a podiatrist, and he was doing some amazing studies, and I think he's bringing out a lot more of those studies. Knowing this, it's not good to keep metals in the mouth. It's just not the best. But again, come and have it checked with a biological dentist. He will then explain and try to make you understand what it means to keep it or what it means to take it out, and then you make the decision.
That is a one-on-one case, right?
Yes.
So you really need to talk to your biological dentist about this and about your particular case.
Your particular case. Everybody should talk about his particular case and then try to understand. I think in biological dentistry what we're doing is we try to address chronic stress. We try to address potential chronic stress. So each area that we have, each material that we use in dentistry can have some effect on you. I like the approach of Melissa, where you have an allergy effect. We also like the idea because people have some point in their life they need something else placed, like spinal surgery, or they have a fracture where they need to have a metal, maybe long term. And then this metal exposure, that's not a choice anymore. So why not take the things out that we can? The other areas that we're looking at is the chronic stress of root canals. We have in dentistry studies that are linking periodontal disease, bleeding gums, to cardiovascular disease, to diabetes.
Absolutely.
To brain. We have just here behind. If we knock hard, he's going to come. We should call him now, just have a quick session with him. He's a clinical psychologist. And then he says how really terrible sugars are. He talks about how terrible stress is. Inflammation, chronic inflammation causes chronic stress. The adrenals are firing up. That stuff is just not good for us. We remove those chronic issues out of the mouth. And what was I saying with the bleeding? Bleeding gums, cardiovascular disease, we have studies that are showing that a inflammation of the root canal can also be linked to cardiovascular disease. Extreme cases, it can lead to extreme situations. We should not talk about this because it just adds again stress. But a infected root canal is not great. Mm-hmm. And then you weigh out the options.
It's a chronic infection, it's a chronic stress. Yes. It keeps going.
Now, for a lot of the patients that we have, they will go the route of saying, I don't want a root canal because I understand that the tooth was at some point vital. Mm-hmm. It had life, it had blood supply, nerve supply, lymphatic system. So once the tooth is dead, I don't want to keep anything dead. So they remove that. That's most of our patients. For some patients, they will then come in, they have a second opinion with us, and they say, I'm not ready to take it out, but they see the inflammation on the root canal. There are other choices to try to redo it and to reduce this inflammation. Sometimes we even do this for the time being to improve the bone around the root canal, and then later they make the choice of potentially taking it out and then placing an implant. I think again, that's again depending which dentist you talk to and how this relationship is between the patient and the dentist. And what steps they feel need to be taken.
Yeah, and it's so crucial to have a dentist that you trust, someone that you can talk to.
Yes.
And that's what I feel also it's happening here in biological dentistry. It's like both with Dr. Goran, with Dr. Domi. You guys are people that we can sit down and talk to. And and you feel at home, you feel good, and you can talk about a lot of things. So it's super important that, and it's very interesting what you said about the teeth being related to cardiovascular disease and things like that, because I don't know if many of you know that my father is a dentist, and I remember in his surgery when I was a kid, he had a big poster that was like illness in the teeth are related to cardiovascular, diabetes. We're talking end of the 80s, beginning of the 90s. Yes. And he already knew that. So this has been known for a while, and we know this. And so
there is a big idea in medicine which is called focal infection. And a focal infection is something that is in one part of the body and then it can transfer to another part of the body. And that's in the books. So focal infection does exist. We are a very complex system and we are still to find out how all of this is working together.
And we know very little.
Yes, and I would say with gum health, with bleeding gums, with periodontal disease, this is many, many times overseen. It's many times not really addressed properly. I feel one of the best ways to address this is with really good clean, but in conjunction with a laser. So the laser therapy really works to address the bacteria. And that's super important for general health, for cognitive behavior. That's why I was thinking to ask Antonio. He would tell us a lot about also gum health and brain health.
And cognitive health. Yeah. Maybe that's an interview that we can do another day. Yes. Shall we do that in the future?
Yeah.
People, comment below if you want us to have another interview about the mental health and about your neurological health related to your teeth. So that's super important. Doc, thank you so much. I don't know if there is anything else that you can leave us with.
No.
All for now. Leave your questions in the comments below because we're going to come back to him and we're going to be asking a lot more questions. So leave them all because I know you guys have a lot of questions every time I publish an interview like this. And we're going to see you very soon. Thank you so much, Doc, for all that you do for us. Thank you. Besos.
Bye-bye.
Ciao. Bye.